So this video is on setting up a pressure transducing system. Regardless of whether you're monitoring arterial blood pressures, central venous pressures, or pulmonary artery pressures, you're going to use the same pressure transducing system. So the supplies you need is a pressure bag and IV pole. You need a bag of normal saline, 500 mils of heparin. These usually come pre-mixed in the hospitals, but if for some reason your hospital is out of these, you can simply use a normal saline bag and mix in the appropriate amount of heparin. Of course, it would be a brand new sterile bag in the hospital. Next, you need a disposable pressure transducer. There's two types out there typically, the three-way stopcock type and the vamp method type. So for this setup, we're going to use the three-way stopcock. With the stopcock method, the hospitals are using needleless systems, so you want to have a needleless cap available as well. When you're setting up the system, it's important to keep infection control in mind, so you want to wash your hands first and preferably put on gloves. So, you take your brand new sterile bag of heparinized saline, you can hang it up in your pressure bag. Usually when this is a brand new bag, you have to rip it out of the plastic package, and there's a little blue clear plastic cover on this that you would pull off at this point. Open up your pressure transducing kit. In it's one complete kit that has everything you need. And then there's a little label and extra caps as well that you can set aside. So when you look at this kit, they bound it with paper. So you can take those paper tabs off and discard of those. This is the IV spike here. So there's a plastic covering on there. Take that covering off and spike it into your IV bag. So following down, when you're flushing this system, it's really important to make sure there is no air in the system. Because these systems are hooked up to arterial lines or central venous pulmonary artery lines, you want to ensure that no air is going to enter the patient. So, of course, in the hospital, we're commonly seeing IVs that are full of air, which tends to be less critical because it's a peripheral vessel and it is venous. Before we start to flush this system, you need to double check all these connections. Everywhere a luer lock is, you want to make sure they're nice and tight. These systems can be notorious for opening at the wrong moment if you haven't tightened these ports all up. So make sure that's tight. Now we can start to flush the system. So this first section we're going to flush is down to that first stopcock. It has a white cap on it with a little hole in the end, and that's going to let fluid actually come out of it while maintaining the sterile sample port there. I tend to flush into the container I took it out of, but you can also flush it over a garbage can. So you can turn your stopcock off to this end of the system, and now when I flush, the fluid is going to run out that way. Now the key to flushing the system is to go fairly slow. If you're using turbulent fast flows, you tend to create more air bubbles. So when you pull on the pigtail, you just want to do it slowly and let the fluid slowly fill the line. There we go. So there always will be a few air bubbles at first, but keep flushing until all those air bubbles are out. This sometimes will require you to tap the line in order to get the bubbles moving. Okay, so once you've got all those bubbles out, you can turn that stopcock off to the side port there and double check this section for air bubbles. A common spot for air bubbles to collect is right in the transducer, and they do put a little black marker in there to help you identify if there is a bubble in there. The next piece to flush is this last piece of tubing here. Take off that paper tab and it goes down to the next stopcock. So again, it has that white cap with the hole, so turn it off to the remaining of the line. And again, flush slowly until the line is clear of air and full of fluid. Good. And then the last piece, again, there is a little white cap on the end here, maintaining the sterility of that end, and it has a hole in it as well to allow the flushing fluid to come out. Okay, so once it's flushed, the next thing you want to do is change these caps. These white caps are only temporary. So the kit does come complete with blue caps, which are your temporary caps and don't allow fluid to come out through them. So toss away those white caps and put on a blue one at the transducer stopcock. Down at the patient side, this is the sampling stopcock. This is where we want to use that needleless system. So open this and apply your needleless cap here. Try to make sure to not touch these open sample ports and contaminate them. Okay, the last thing you could do is the labels that come with this system are indicating arterial, CVP, or pulmonary artery pressures. Those are the most commonly monitored. So there are associated colors. Some people for the arterial line, for example, will take this little red dot and apply it on the stopcock so that the color system will match. Again, that is optional. When you're done with the pressure monitoring system here, you want to make sure you do up your pressure bag and pump it up to 300, because that's the pressure that we will use regardless of the site that we're monitoring. And again, the other thing you want to double check is your zeroing. So we will try to show you how to zero on the next video.